Hello, thank you for listening in. My name is On Iftikhar and I'm a solutions architect with AWS. Today, you'll also hear from Nathan Anstis from New South Wales Health Pathology, a customer of ours. I'd like to start off by asking you to think about or recount how many times over the last few months have you struggled to find accurate and timely information about things like when is it safe to go out again and what precautions you should be taking, where to find the right care for yourself and your loved ones, and simple things like when your kids can go back to school. Similarly, government entities and healthcare entities are focused on and often struggling with keeping whole populations informed in an effective manner. But what if you, as a provider of healthcare services or government services, could build a scalable system on AWS within days to deliver critical information to your citizens at a time they need it most? It's a simple paradigm. During critical times, citizens look to their government for up-to-date, accurate, and personalized information. The challenge for government entities is getting trusted and timely information to members of the community and guiding them towards the right education or care, all at scale. An inability to fulfill this requirement can lead to citizens going to other sources for that information. And misinformation can cause fear, uncertainty, doubt, or worse. It's equally important to ensure that as a government entity or healthcare provider, your key resources are available to tackle the challenge that is in front of them and provide care to those who need it most, rather than having to spend time addressing repeated queries for the same information. But how can you do that quickly at scale at a time of crisis? And therein lies the challenge. Traditional communication systems can take months, if not years, to stand up. You have to pick the right software, you have to purchase hardware, plug it in, install it, and get it up and running. That can be an extremely long and costly process. You also need to ensure that whatever system you're putting in place is able to scale to meet the requirements of an entire population, which in a time of crisis can be extremely hard, if not impossible, or very costly if possible. The cost of failure is also very high. But what if you could reduce this time to value? That's possible with AWS today. You can leverage AWS engagement services to build a solution in days. These services are built to be dynamically scalable. So if the number of individuals engaging or the messages being shared goes up, the system will spin up more resources to meet this demand. And also, just as importantly, as consumption goes down, these services can be scaled down. This means that you don't have to pay for idle resources. Now let's have a quick look at some of the properties and expectations of an efficient cloud-based communication solution. The information provided must be timely and up-to-date. The system must scale to meet demand. In a time of crisis, a citizen being told to hold on or go away and come back later is simply not good enough. It's also imperative that any sensitive information that's being shared is accurate and communicated securely. Citizens today expect to be able to ask for the information they need and receive guidance specific to their requirement. Hence the need for two-way personalized communication. You also want to be able to provide citizens an opportunity to engage with your system via an interface that they're most comfortable with, or one that matches their ability. Be that a web portal, or a mobile application, a chatbot, SMS, or voice. You want to open that opportunity up to them. We now look at 3 AWS services which can form the core building block for an effective, scalable, and secure citizen engagement solution. First up is Amazon Connect. Amazon Connect delivers a complete contact center in the cloud which can be set up in minutes at the fraction of a cost of a traditional contact center solution. Amazon Connect supports inbound and outbound telephony. Like all AWS services, pricing for Amazon Connect is pay-as-you-go. And there's no requirement for long-term commitment or activation fees or minimum spends. You can instantly scale up and down to meet your needs without having to worry about telephony, hardware, or space and capacity. Now, one of the key features that Amazon Connect provides is the ability to set up automated conversation flows. And these can be used to address frequently asked questions or capture repeated information automatically, which means that your contact center agents and staff can focus on speaking to those needing that specialist guidance. Next up is Amazon Pinpoint. Pinpoint is a multi-channel communication service which delivers transactional, promotional, and mass communications. It supports multiple use cases like sending immediate trigger-based communication, as well as bulk sending of notifications and announcements to whole communities, all the while allowing to track results and engagement. It supports communication via SMS, email, push notifications on a mobile, voice, and custom integration with social media platforms. Amazon Pinpoint can grow with you and scales globally to billions of messages per day across channels. Last up, Amazon Lex. Amazon Lex is a service that helps you build conversation interfaces with voice and text. Amazon Lex uses the same machine learning language understanding capability that powers Amazon Alexa. With Amazon Lex, you can build your chatbot once and deploy it across multiple platforms and communication channels for a consistent user experience. And as with the other services, Amazon Lex scales automatically to meet demand. The last thing I want to touch on before I hand over to Nathan is some of the key things you want to keep in mind, the important things that we've learned working with customers and building these efficient and scalable solutions. You want to build for scale, and this goes without saying. But you want to ensure that whatever system is put in place can scale to meet population-wide and changing demand. Leverage services which allow you to scale on demand without manual intervention. Build serverless where possible. Load test your solutions to understand where your bottlenecks are. While your backend compute systems may be able to handle hundreds of thousands of messages per second using services like AWS Lambda, you may not be able to send those messages at the same rate to your consumers. Use mechanisms like message queuing and information caching to manage load on the most constrained parts of your architecture. The component which is perhaps the hardest to scale is human resource. You want to build automation into your solutions to allow for most customer queries to be addressed automatically without the need of human intervention, leaving your critical human resource to focus on helping where it's most needed. Enable multi-channel communication systems to make it easy for consumers to engage via a medium of their choice. Remember, the most effective mass communication systems are those that are the most widely adopted. You want to ensure security. Understand the sensitivity of the information being shared and put in place mechanisms to store that information as it's stored or in transport. AWS services make it really easy to encrypt data as it's stored, as well as enforce encryption in transit. Leverage that to your advantage to build resilient and secure systems. Be aware of limits. AWS has service limits to protect you from unexpected excessive utilization or malicious actions intended to increase your bill, as well as protecting our service endpoints. Some of these are soft limits, which can be increased on request. For example, the number of active calls on your Amazon Connect instance, while others are hard limits, which cannot be changed. Understand the limits for the services that you're using. Monitor and apply for increase in these soft limits in advance. And this can all be automated. And the load testing that we talked about earlier will help you understand the limits within your architecture as well. And the last thing I want to touch on is enabling visibility. Define, capture, and analyze metrics to gain visibility of system behavior. Understand which parts of your architecture are being constrained. Monitor and alarm on those key metrics. Analyze customer interactions to understand how you can improve and which frequently asked questions are not being addressed automatically. At the same time, you want to be able to narrow down and investigate individual customer interaction. Enable logging to allow you to do so. With this, I now welcome Nathan to talk about New South Wales pathology and walk you through their journey of building such a solution in response to COVID-19, the challenge they faced and how they stood up a solution within days to address it.
Before I begin, I would just like to acknowledge the Gadigal of the Eora Nation, the traditional custodians of the land from where I'm presenting today in Sydney, Australia, and pay my respects to their elders past and present. My name is Nathan Anstes, and I've been a DevOps engineer at New South Wales Health Pathology for the last 2 years. And throughout that time, I've been exposed to much of the AWS ecosystem and have built out some of our large data platforms that we have in production today. New South Wales Health Pathology is a public healthcare provider, meaning we're part of the government and provide a pathology service across the entire state of New South Wales, which has a population of over 8 million citizens. For those who aren't aware of pathology, just for an example, if you've had a COVID-19 test recently, you may have had the throat and nasal swab, and the testing and analysis of that sample would be conducted by a pathology service. Across our broad range of tests, we perform in excess of 60 million tests per year. As the pandemic hit at the start of the year, our business observed some drastic changes. The most obvious one being the increase in testing volumes and the high demand for our services. As a test is being performed, a part of that process involves a notifying of the patient of their result outcome. So as more and more tests were being performed, the more people we had to notify. And this was becoming drastically worse over time and was identified as a bottleneck. As people were being admitted to the emergency departments, getting their tests, and then waiting days for their results, they began understandably impatient of this and started to call up inquiring about their results. We got to the point where hospitals, clinics, emergency departments were all just answering phone calls, trying to handle the load that was happening. And the usual time of getting that test result back was up to 2 weeks, and usually involved going to your GP and talking through your result. So there's a few things that needed to happen in order for us to address these issues. The first one being that we want to be in a position where we can handle the capacity that is happening across the state of New South Wales, and even be in a position to encourage more and more testing, because the more tests that are being performed, the safer we are as a population. We also want to get visibility across the state for an emergency response perspective, so we can handle at a high level the interactions across the state, the turnaround times, and how we can improve our service. And we actually have an emergency operations center to do this type of work. For the emergency departments that were just being overwhelmed, we want to take on a lot of that work that they were doing, and we want to get them back to be doing what they do best, and that is saving lives. And lastly, we want to make sure that 2-week turnaround time is eliminated. We want to make sure we have a quick turnaround time, and that involves going directly to the patient, the person who needs that result most. And we did. So in order for us to achieve all these things, we had to establish some goals. So the first goal we had was wide adoption. So in order for our service to be effective, we needed to appeal to everyone. So not just those that are tech savvy, not just those that live in the city. We want to appeal to people in rural Australia as well. We want to give time back to emergency departments. So we want to take on a lot of that automation and free up their time. Another thing we want to do is significantly reduce those turnaround times. And most importantly is we need this now. So the time that people are waiting for these test results is a very stressful time. For those that aren't at risk, we want to make sure they can get safely back to work and back on with their lives. So we've delivered this, but how do we do? So by now we have delivered well over 1 million automated test results using SMS as a way of delivering those. Our adoption rate is between 80 and 90%, which we're extremely happy with for those that are getting tested. And we're able to get result notification back within 2 hours of lab completion. And this is typically within 24 hours of them getting tested. And from this service we built and the automation that it holds, we were able to get back 180,000 clinical person hours from this process. So we've achieved some large-scale impact here. But best of all, we were able to go live with this service within 2 weeks and with the use of a single resource and some advice from an AWS partner. And I'm excited to be here today to tell you about our journey, how we achieved that. So let's talk about the service that we needed. So firstly, for the patient, they need the ability to register themselves as well as receive that automated result. And they're going to be a back and forth conversation with our service. We have the testing laboratory that needs to be able to produce those results back to us. This is like our result data. Our business stakeholders will need some operational dashboards. An example of a business stakeholder could be someone like a member of our emergency response center who cares about the high level activity across the state so they can manage those resources. Or it could be someone like a lab manager who just cares about their small section of the state. Lastly, we have our call center agent. We have the requirement to be able to resolve any registration issues, because any service like this will have some issues and we need some people to resolve that, as well as have the ability to make contact with the patient. So if we just blow out this system here to make room for some architecture, we can fill this. So here we have a fully serverless architecture, and it's important for several reasons. So firstly, we get the scalability benefits here. So because we only operate in a single time zone, and people usually interact with our servers after getting tested, our busiest time of day is around midday or early afternoon. And at night time, there's really, really low activity. So with a serverless architecture, we have the ability to scale up for the high demand throughout the day and scale down to get that cost optimization. With a system like this, we also are able to reduce the operational complexity because of our limited resources. So instead of looking at it all together, what we're going to do is split up this architecture into some small chunks that are easily digestible and easily to understand. So some key services that we need to think about are Amazon Connect for our call center for patient engagement. We've also got Amazon Pinpoint, which allows us to use SMS as a way of communicating with the patient. AWS Lambda will be holding our business logic. With a service like this, we also need the ability to store conversation state. So as we're communicating back and forth with a patient, we need to store that state somewhere and to know and to try and remember where we're up to in that conversation. And we use Amazon Lex for that. S3 is our data lake. So as we're getting data in from all these different testing laboratories, they all come in different formats. So we need an intermediary place to place this data, which can then be transformed into Dynamo, which we use as our live transactional database. And that holds data like the registrations and the results as well. We use SQS for message queuing and Amazon Redshift for our data warehouse, which allows us to plug in our dashboarding, our operational dashboards. So by now you're probably thinking, why are we using SMS? Why not just use a web portal like most people do? Well, for any complementary service like this, we sort of expect it to be free. So we have that. And the main benefit of SMS is its simplicity. So one of our goals was to strive for wide adoption. And the way of doing that is by making sure we have a simple service that everybody can use. There's no third-party app needed. You don't need internet connection. So for those out in rural Australia with limited internet connectivity, this is a perfect solution for that. And lastly, SMS is seen as a difficult attack vector. And that's mainly because it is expensive and it's not very economical for hackers to attack services like this. Another downside to this is it's not end-to-end encrypted. Although parts of the protocol are encrypted, end-to-end it's not. And when you think about SMS as a communication method, you typically think about promotional notifications or campaigning. It's not really used for this stateful transactional communication. So those are some hurdles that we had to think about and come to agree on. So let's jump into our first piece of architecture here. So thinking about the patient and how they're engaging with our service, what we have here is an architectural block which allows them to have a back and forth conversation with them synchronously. So firstly, the patient will contact Pinpoint. And we contact a long code here, which just looks like a normal mobile cell phone number. They might say something like, hey, I want to register for your service. That message will get chucked on an SNS topic, which is picked by a Lambda function. So at this point, we have the Lambda function will have information like the long code, so the pinpoint long code that they communicated on, the patient's mobile, who was doing the communicating, and the message contents itself. So here we have information that we can pass to Lex to say, what do we want to ask the patient next? So we get a response from Lex, and then we send that back out to the patient through pinpoint. And that completes the cycle of a communication. Now, when we have our conversation state within Lex, we have a user ID which we use as the patient mobile. So that means that different people on different mobile numbers can have independent conversations with Lex, which is serverless as well. Now, behind the scenes of Lex, we have some Lambda functions there as well. So firstly, we have a validation Lambda hook, which allows us to perform custom validation on each of the inputs. So let's just say the user gave us their date of birth. Perhaps we want to perform some validation here that makes sure it's not a date in the future, or maybe a date that's not 200 years ago, something like that. And then once we get to the end of the conversation, so we communicate back and forth, we get to the end of the conversation, which we call in Lex an intent, and then we're passed to the fulfillment Lambda hook, the bottom one there. And we use this as a form validation, a form submission type of functionality. So if this was gathering registration information, from here we could then populate that into DynamoDB. Just to get a sense of what this looks like, I've got a middle snippet of a conversation that we're using through SMS here. So as you can see here, we're grabbing information like the postcode, the date that the sample was collected on, and a confirmation SMS here, just to confirm that the details they've entered is accurate. Now with some of these Lambda functions that are communicating through pinpoint, you have to be aware that you can only send one SMS to a single recipient per second. So this means if the patient sends, maybe by accident, 2 messages at the same time, we will try and respond to them as soon as we can, which could be in the same second. So we need to make sure we have throttling mechanisms and retries within the Lambda function itself. Now, still talking about the patient. So let's just say it's been 12 hours since they've registered, and we have a result available for them. We need an asynchronous background process that allows us to notify the patient that their result's available. So anywhere within the service, we could chuck a message on our FIFO queue. So SQS FIFO is first in, first out, and that's the core of this architecture block here. So this FIFO queue has some functionality such as content-based deduplication, which means that we can only have the same message contents once in the queue. So for distributed systems, sometimes it appears that there's duplicate messages appearing, and we want to make sure that doesn't happen for our patients. We just want them to have one of each. We also use group identifiers for our FIFO queue, and the value we use for this is a patient mobile, which means that all the messages with this group identifier, so for this patient, all will be sent out in the exact order they were received in. And because we use this group identifier, which is unique to the patient, we can actually have multiple Lambda functions which poll this queue, and we can have multiple instances of these to make sure we get the results out as fast as we can. Now, this Lambda function also serves as a way of limiting how much messages can be sent out through pinpoint. So rather than event-driven architecture, we just sends it out as soon as we get it. We may not want that. Maybe we only want to have 30 messages per minute or 100 messages per minute that we get sent out, and this gives us a mechanism to control that. Another thing to be aware of in this instance is that users can actually opt out of receiving SMS messages. So in our case, if we're trying to send a message to a number that has opted out, we will be unable to deliver it, and pinpoint will reject us in that case. And that will drop to a DLQ, which is a dead letter queue. So there could be several reasons for this. It could be a deliberate opt-out, and they actually don't want to receive messages, so we should respect that. Or it could be an accidental opt-out. It could be they've just triggered a keyword like stop or cancel, and we could actually opt them back in if we wanted to. So there's an operational overhead around that DLQ message there, that DLQ there, and we need to be aware of that. So next, we're going to talk about the business stakeholder and how they get their operational dashboards. So before this architecture here, our original solution was to perform a periodic copy of data from the Dynamo table into Redshift. And as our records grew into the millions in Dynamo, it was taking a bit longer than expected to get that data synchronized into Redshift. So because of that, we moved to this architecture that you see before you. And this is an event-driven architecture which pushes data into Redshift. So each time a new, say, a result is pushed into Dynamo, Dynamo event stream will then trigger a Lambda function, which then forwards it to a data kinesis fire hose. So then it'll be batching in data here, and then pushing that to Redshift through a native integration. And lastly, we have our call center agent, which has a few requirements. So their job is to monitor our Atlassian Jira service desk, which has all registrations that require some manual intervention. Now, our service is creating Jira tickets every time a registration has been without a result for a specific period of time. So when they scroll through Jira and find a registration that needs to be investigated, that will open up a link to our custom Angular application, which is the CDN CloudFront. Now from here, they should have all the information they need to find and debug the issues with that. If there's been a typo in the registration and they've had to contact the patient to make sure that that's what has happened and they confirm their details, they could then repair that registration through the REST API that we have here. And that REST API is implemented with API Gateway and the Lambda function. And that could be doing something like modifying a DynamoDB record or bringing in more information to contextualize that registration. If the call center agent needs to contact the patient, they can open up Amazon Connect to make that patient engagement. So just concluding and reiterating our milestone of 1 million automated test results that we're super proud of. This entire journey has been opening to a business transformation here. So typically we deal with patient referrals. We don't deal with the patient directly. But through this journey, that allows us to actually do that. And we've realized how much we've enjoyed it, how much we're good at it, and how we want to continue doing things like this in the future. And then this is a little quote there just to say, as a young mother, how important it is for them to get their results back in a timely manner, because this is people's lives, and every hour that it takes, it is causing stress, and we want to make sure we can alleviate that as much as we can. In terms of next steps for our business in the pandemic, we're always looking at more ways of improving the patient experience. So that could be expanding communication channels, looking for more areas of automation that we can serve. We could expand out into clinic appointments. And then, like Owen mentioned earlier, is looking at more methods of communication. So looking at things like web portals or any inbound capabilities through IVR, inbound voice response, as well as looking at other cross-agency integrations. And these are all ways of just trying to improve the patient experience. And then lastly, just to mention some more exciting work we're doing is in the space of genomics and standing up our statewide services for the whole exome and whole genome services. And hopefully like to share some of our success and challenges in that area.
Thank you, Nathan. Now let's quickly recap what we looked at today and what we covered. We looked at the challenge that is crisis response from the perspective of citizen communication. A few AWS services that can act as core building blocks for a scalable and resilient communication system. And we looked at some of the best practices when architecting for scale. And Nathan walked you through how New South Wales Health Pathology, as a customer of AWS, responded to the crisis. And some of the repeatable building blocks using these services that they built that you can use too. I'd just like to leave you with a few resources to get you started. Now, these are a couple of AWS blog posts with deployable AWS CloudFormation templates, which means you can deploy these solutions into your AWS accounts, learn from them, and build on top of them. So feel free to leverage these. Also, if you're looking for more general guidance around AWS architecture best practices or reference implementation and blueprints that you can get started with, you can leverage these resources up on the screen. And all of these will be available to you as part of this recording. Now, thank you again for listening in and taking the time. Please take a few minutes to complete the post-session survey and provide us your feedback. Thank you.